Thank you all for remaining awake and in the room for this last presentation of this exhausting session. I really appreciate it. I got very interested in the physiology of immersion as I started working with clinical populations of rehabilitation patients and figuring out what the heck is going on here that is working so well for my patient population. It turns out that we know quite a lot, and that many of the people that have presented before me through this day have been critical in developing the research base for aquatic activity. We know that aging produces a reduction in arterial vessel elasticity. The arteries get stiffer as they get older. A lot of things sag in our bodies, but the arteries don't sag. They get stiffer. They don't respond as well to neurologic control, and that's a problem. That effect raises blood pressure, which accounts for age-related changes over time, as was talked about earlier by Dr. Tanaka, and it reduces circulatory efficiency through the body. The heart has to work much harder to push blood through the whole vascular tree. Aquatic activity has been shown to increase vessel elasticity both during and after a period of aquatic exercise. This is mostly work that Dr. Tanaka and others' labs have produced, and it increases efficiency in both large and small arteries throughout the body. That's a very, very positive thing, and it is significantly better with aquatic activity as compared to land-based activity. This is work out of Dr. Tanaka's lab. It essentially, jumped ahead. It essentially looks at 12 weeks of swim training, 3 or 4 days a week, and then a control group of attention control patients. That is to say, they're sitting, they listen to lectures for the same period of time that the other group is in the swim program. And as you can see, in carotid artery compliance, that's the major vessel that supplies the brain. Now, the vertebral arteries also supply some of the brain, but the carotids are really key. And as you can see, the swim-trained folks start out pre-training the same as the controls, but at the end of that 12-week period, they are statistically significantly better in carotid artery compliance. Now, that carotid artery compliance is really due to changes that occur within the vessel itself. Blood vessels are a complicated structure. They have an outer muscular wall and an inner wall called endothelium that basically sends out signals saying relax or contract. And the key function of that has to do with a complicated chemical structure called endothelial nitric oxide synthase, and you don't have to be tested on that. This compared work in an aquatic treadmill with work on a land-based treadmill. And as you can see, the aquatic treadmill produced a much more dramatic result than the land treadmill in terms of endothelial function change. A group of Australian researchers took some of this information and said, what's going on in the brain? What's happening to brain blood flow? So they did a very interesting thing. They took a bunch of subjects, they put them in tanks that they constructed, they measured vertebral artery, they measured flow through the posterior cerebral artery and the middle cerebral artery, 2 key brain blood supplies. And what they found is that as soon as they got them in water up to waist level, brain blood flow was already increasing. And as the water rose yet further, it increased even yet further. The velocity of blood through those arteries was significantly enhanced. Now, this is just standing in water. This is not doing exercise. So that same group said, well, gee, we know normally that what happens during exercise is that flow is oftentimes not very increased and then sometimes decreases. So they looked at the anterior and the posterior cerebral artery velocities, and they found that they rose, but the blue line is essentially the aquatic line versus the other line, which is land-based activity. So not only did blood flow increase when you were just standing there, it increased through the period of exercise as well. So aquatic immersion has been shown to positively impact brain blood flow and carotid artery diameter and cerebral blood flow velocities during immersion. And it increases significantly, produces much better blood flow to the brain. What happens with peripheral blood flow? Immersion and exercise produces a positive effect on reducing blood pressure, increasing arterial elasticity, and cardiac efficiency. The end results facilitate an increase in blood flow velocity in both brain blood flow and peripheral arterial blood flow. These are really powerful effects. And water does this better than land exercise. Who knew? These velocity-driven effects act over time to produce significant changes in the internal structure of the arteries and fight the effects of aging. Is anybody in this audience aging? Oh, yeah, a couple of people are. These aquatically produced adaptations result in improved circulatory function, brain function, and health. I don't know what you can say, but water really is magical. Water produces unique effects, and truly it may be said that happy bodies are all wet. And I thank you.